So, Richard, what do you see as the biggest problem for employers regarding their group medical benefits?
I think it's the same problem that we've had for the last umpteen years. The premiums are high, and they keep going up higher and higher, and employers don't have any control over that. I mean, what happens is that every year you sit down with your agent. What does he do? He brings in your current program and 2, 3, 4 other choices. The only thing that's consistent about them is that all of the premiums are higher than they were before. So you have absolutely no ability to control that. So the premiums have been rising about 11% per year for the last 10 years in a row, and employers simply can't handle that. That's unsustainable. We end up with a situation where that there's no hope in sight, especially with Obamacare and all the rest of the changes that are coming up now. So that's the biggest problem. Premiums keep going up, and there's no control.
Well, given that, is there anything that an employer can do about this? I mean, they should be able to have some choices, right?
You've got to have choices. I mean, and that's the problem, is that you have to figure out how you can gain control over what you're doing. You have to have an ability to be able to handle something so you know what your future is going to be like. Let me give you an illustration. Compare it to something that everybody's familiar with: the cost of gas. We all have to buy gas, and prices for gas keep going up higher and higher and higher. We have no control over the price of gas, but we do have some control over how much we use. So if you take some actions, like you get a car that has better mileage, you carpool, you live closer to your work, you make some action like that, and you end up with an immediate reward. You pay less for gas, and you're able to take some action and have some control over what you have in the future. Healthcare should be like that, but it's not, unfortunately. What we have is a situation that is really perverse. It's a situation where you have absolutely no control over the cost of care, and you're in a situation where you're not able to do it unless you create programs perhaps within your organization that allow you to have some control on that cost.
Mm-hmm. Well, that makes sense. So how do you do that? How does an employer do that? Typically, they're having a fully insured program, and they're paying a premium, and no matter what they do, the premium goes up.
That's very true. What you do is there are a number of different types of programs. It's not your typical coverage. It's not your typical programs that you can see out there. You need to create programs whereby you employees have the ability to change the way that your program is currently done. You should have, if your employees do the right things for your health, you should have the ability to be able to have that translated, in that good health translated into lower premiums.
Mm-hmm.
Okay?
Makes
so
sense.
what you have to do in that type of situation is you have to create programs. We have companies that will actually pay you and your employees for taking the right preventative action. And they'll do that and give you a lower premium because they know that if you've taken preventative action, that you won't have as severe or as costly large claims. And they'll do that, and the premiums are lower because that's what they know. They know those claims won't be higher, therefore they're able to give you lower premiums. We also have programs where you're able to increase the deductibles, and very safe for the company, for the employers, but you keep the money if you don't use it. So we implement programs that are able to reduce those costs, and then have a program within your company where you keep the money instead of giving it to the insurance company. Then you have an ability to control your costs, not only now for an immediate reward of lower cost today, but also in the future, so that when your renewals come up and when as time goes on, you're able to actually reduce the cost.
Well, that sounds well and good, but I think it sounds also complicated to most employers. What do they do next? How do they make use of this idea that you have?
That's what we do. That's what we do as a company. We have the systems and we have the programs and the products. We are able to implement those very easily for the employers. These are programs that are set in place, and we have the staff and the resources to be able to implement them within the firm. So it becomes easy, becomes simple, and best of it all is that over the long term it reduces costs.
So an HR director or a VP of human resources that may be not sure about this kind of programs we're talking about can feel pretty confident in saying that they'll fit into the organization, they will be able to save money, and you guys will take care of all the details that make it work.
Yeah, probably they will end up with less work because we end up working very closely with the employees, those that wish to participate in the programs, to be that they are able to do that, and then that takes some work off of the HR director.
If you're a VP of HR right now, simply going with a fully insured plan that you pay a premium on every month, you're probably beginning to be in the minority of companies that are doing that. Most companies are switching to programs like you're describing. Isn't that accurate?
That's very true. That's very true. In terms of self-funding or partial self-funding, that type of thing, literally, I believe the number is that over 40 to 50% of all employees are in some sort of a self-funded program.
Mm-hmm.
But that usually refers to larger companies. It doesn't have to be.